All right. So good evening, everyone. Welcome to our fourth webinar as part of the Telehealth Initiative. And this webinar is going to be focused on partnering with patients. For the agenda today, we'll cover best practices for partnering with patients for successful engagement of telehealth. We will also be having a few polling questions throughout the presentation this evening that will help not only guide the round robin and practice updates, but also help to inform kind of some future direction for how our project plan for the initiative can or should be adjusted. And then to close, we'll review a few next steps and answer any additional questions from the group. This webinar is available for 1 AMA PRA Category 1 CME credit through the Massachusetts Medical Society for physicians participating in the live activity this evening. And this group has no disclosures. And then in terms of our CME objectives for this webinar, participants should be able to develop materials and a plan to appropriately communicate with patients about the practices telehealth offerings following completion of tonight's webinar. So we're going to go ahead and do our first of 4 polling questions today. So Shannon is going to pull up the poll, and we'll wait a few moments for everyone to have a chance to respond. But the first question is going to be around what challenges have you encountered in delivering telemedicine to your patients? And you should be able to check all that apply. All right. Like we're climbing in the numbers a bit. And it's like the most common challenge is patient technical literacy. So difficulty with the platform and audio visual challenges. All right.
We still have a few more coming in, but we'll end it in just a few seconds. So if you'll complete your selections. All right, we'll go ahead and end polling.
Great. Thanks, Shannon. So that's really helpful information as we kind of move forward, not only in this presentation, but as we think about what's next for the initiative and just, even more broadly around the challenges that are likely being faced not only by the physicians in this group, but some of the physicians across the country that are using telehealth. So thanks for going ahead and answering that question, and hopefully we can start to address some of those challenges now and continue to work towards addressing those in the future as well. So now to dive into the content for today, we'll review why partnering with patients is important, outline key considerations for creating successful engagement around telehealth, and then some additional suggestions for promoting and marketing telehealth offerings to your patients. Next slide, please. So leveraging telehealth in your practice is ultimately relies on patient interest and engagement. So it is a really important step, and it will be really important again, especially once some of these in-person visits resume as normal. And I think many physician practices are now starting to reopen, start to see more patients in person. So really kind of understanding what your patients need related to telehealth moving forward will be helpful in continuing to have that engagement around telehealth in your practice. Preparing patients and setting them up for success is crucial. As you transition into that more normalized schedule, it's an opportunity to really ensure that your patients are aware of telehealth as an offering beyond COVID, right? And when it will be appropriate for use moving forward, because that may look a little bit different now that we're kind of even starting to transition to, I'll say, post-acute COVID. So that will be a really important time to really set those expectations. And it's a good time to help patients get a little bit more acclimated and comfortable with the technology, especially if you are seeing some of them in the office now. So those are some of the key pieces of why partnering with your patients is important, really, to scale successfully moving forward. And we've identified, next slide, please. We've identified some best practices to help as you partner with your patients. So engaging patients at multiple touch points early to ensure your offerings work for them too. And again, it's a really good time to kind of reset and speak to patients about what works for them in a more normal environment. And as you develop your workflow, make sure that you're accounting for how each step in that flow may impact your patient or what they may need to know at that point in the process. Again, setting those expectations early and often will just help for a successful use of telehealth moving forward. This graphic to the right actually starts to map out various touch points in the workflow to consider when and how and through what channel you could consider messaging to or communicating with your patients. You also want to work to ensure telehealth offerings are inclusive. Much like many of you just recognized or displayed on the poll, helping to identify barriers to tech access is really important. And what type of technology is going to set you and your patients up for success. And then additionally, if you are having patients, for example, that maybe don't have access to technology itself, with some community resources and facilities like that starting to kind of reopen as well, pointing out some of those opportunities for your patients to access technologies through those resources might be an option for your environment in the future as well. If you do not speak the same language as your patient, consider working to incorporate an interpreter or translator. And I know that's probably not the easiest thing with some of the kind of two-way technologies, as well as just kind of being new to telehealth in general and kind of introducing that third person or component to your visit. But not only will that help with the interaction, but also as kind of a stepping point to integrating other practice team members into telehealth visits as well. As you continue expanding telehealth, consider doing potentially a group demo in the office for those that may be less tech savvy ahead of future telehealth visits. Again, this may be an opportunity to have exposure to some of your patients in person at touch points now with practices reopening that may help them navigate for future success with telehealth visits. And then including caregivers as appropriate is a key component to that practices can think about doing as necessary and applicable to their patients. And finally, being prepared to obtain feedback and iterate and adjust as needed. Getting that feedback from patients will be really important, not only for how telehealth is working for them in your practice, but you know, even at the more national level and as part of this initiative, collecting that patient feedback is really important because it's also going to help drive certain things that may stick around or should stick around post-COVID. And that experience on top of physician experience with telehealth is going to be really important to making some of those things stick around. Next slide, please. And these are just a few of the resources from the playbook that you can use as samples and adapt to your practice's needs that can support communicating with patients about telehealth and also giving them information to take home so that they know what to expect for their visit and how to prepare for that visit. So I'm going to turn it over to my colleagues Yvonne and Bisan to dig into some of the additional details to help you further operationalize these aspects of your telehealth program and start or continue engaging patients to drive successful telehealth interactions.
Thanks, Stacy. Sorry, can you guys hear me okay? Getting a little feedback. All right, so when you're introducing telemedicine to your patients, there are certain things that you want to make sure that you include in whatever written materials or descriptions you're giving regarding telemedicine. So you want to have a description of what telemedicine is, the benefits for your patients of telemedicine, an overview of the technology specific to what platforms you're using, that type of thing. You're going to want to include safety information. Many people are concerned about HIPAA and you know, whether or not their information is going to be safe or out there on the web. And then you're also going to want to include some application or website links for them as well. So you want to provide written materials in a variety of formats to account for different learning styles. Having them available on your practice website, a patient portal, written information in your office in the forms of pamphlets or you know, handouts. I'll give you an example of one here in just a moment. You also might have access to some vendor materials that you can provide to your patients. And then any materials that you've created in your practice yourself, maybe that's specific to how the process works in your office, what the procedures are, who to contact if you have difficulty, things of that nature. And then lastly, you want to designate staff to provide that one-on-one patient education. As Stacy mentioned, you could do a group setting. If you're not able to do that, particularly now in the COVID-19 moment, then having that one-on-one patient education can be helpful. And I think that probably my guess is that the fact that so much of the telemedicine has been fast forwarded as a result of COVID-19, you know, patients didn't get that face-to-face one-on-one education and information ahead of time about telemedicine. It was kind of thrust upon all of us. And so it's not surprising to me that you're finding that there are technical issues that patients are having difficulty with that. But you can have your clinical staff do that. You can have non-clinical staff do that. You just want to make sure that you put that in your workflow when you're talking about how you're introducing to patients. Next slide, please. This is an example of a handout that you can give to patients, a couple of handouts you can give to patients about you know, some visit tips and telemedicine FAQs. And you would want to, of course, customize this to your practice. Next slide. We can have this available, by the way, after the webinar, just for your information. Now, as far as description of benefits, you want to drill down a little bit to the information here. Patients, be helpful to include in your patient education information the difference between telemedicine and telehealth. Just making sure that they understand that telemedicine is what their physician is providing them, that actual medical care, and that telehealth can include many other things, you know, visits with dietitians or PharmDs, or perhaps remote patient monitoring is also under that telehealth umbrella. And then you want to include how it works. You know, that it can be audio and video. Currently, we're able to do audio only. Hopefully that will continue. How are they going to schedule a visit? Who do they call? Do they do that over the patient portal or on the website? And then again, you want to stress the benefits, because the benefits are really really going to be the key to getting your patient completely engaged and helping them understand that, you know, there's, you know, less time away from work, and that you know, they can potentially not have to worry about dealing with any kind of traffic or parking, that they don't need to make childcare arrangements. They can do it in the comfort of their own home. They can do it at their office at work if they so choose, as long as they make sure that they're maintaining a private environment. They won't be sitting in waiting rooms, that kind of thing. You want to appeal to patients' priorities and needs, right? Timely access to diagnostic results, all that type of thing. Next slide, please. Alrighty, and then with the technology, the information you're going to want to include in that patient education is going to be internet access, helping them understand what type of access will be necessary, you know, high-speed Wi-Fi, 5G, that kind of thing, or 4G. What type of devices they can use. smartphones, tablets, computers with built-in, cameras or webcam that they can purchase separately. You want to help introduce them to the applications. And again, you'll provide that in writing, maybe even talk through it one-on-one, personally, or over the phone, however that occurs. And then also include troubleshooting information. If they're having difficulty connecting, what kind of steps can they take to remedy that? And if they're really struggling, who can they call or email or whatever? And then last but not least, the safety and effectiveness. Or the safety, which includes effectiveness and confidentiality, excuse me. So the effectiveness, some of your patients may have some concern about whether they can get appropriate care via telemedicine. So it's some information you're definitely going to want to include to help them feel more comfortable and help them understand that they are getting the same level of care, and that if at any point in the course of doing telemedicine, that you would, if need be, request that the patient come in to be seen. And then once again, that confidentiality, the HIPAA concerns, explaining that that there are different types of applications and platforms that provide greater confidentiality and adhere to regulations, things of that nature. Let's see. And I believe that is it. I'm going to pass it over to Bisan.
All right, can you guys hear me? Because I changed the audio setting a little bit.
Yes, you sound good.
Is that a yes?
Yes.
Okay. I don't know. I hear feedback, but hopefully it's not as bad. All right. Thank you, Vaughn. Good evening, everyone. In the next few slides, I want to talk a little bit about the patient experience and few marketing tips. Why do we always talk about improving the patient experience? For telehealth, just like any service provided in the healthcare setting, patient experience is significant to any organizational strategy. Research shows that better patient experience leads to enhanced clinical quality processes and increased and improved health outcomes. Recognizing the benefits of a patient-centered approach to care, payers are increasingly implementing financial incentives, as we all know, for providers in incorporating patient engagement and shared decision-making into the care models. Practices, as you are all, let's stay on the first slide. Let's just stay on here for a minute. Practices are being surveyed by CMS, by the commercial plans, by state organizations. For example, in Massachusetts, we have one of the organizations that does a statewide survey every year for primary care doctors with almost 300,000 patients that get asked to rate physicians about provider communication, care coordination, ease of care, ease access of care, office staff, professional excellence, among other measures, and it is publicly reported. Even in this crisis context, patient experience remains an important topic. For the first time in a short and expedited terms, our traditional ways of providing care and healing to our patients had been altered, and we have an opportunity every day to enhance their experience. We are learning to build a unique relationship with new or existing patients via technology, and refocusing on virtual empathy and seeing things from the patients and the family perspective, and becoming more creative in developing ways to connect with them in a transparent manner, whether the patients are at home or in their cars or in the parking lots or in any other innovative side of service. Unless you normally do home visits, telehealth gives us a broader opportunity to connect and build that trust with our patients on a deeper level, because you are now treating them at their home, communicating with their family members in ways we've never experienced before. We as the people on this side of the equation, busy and focusing on implementing new technology and choosing a vendor or trying to get reimbursement for telemedicine visits or learning new tips and tricks on how to practice medicine virtually, we want to keep in mind our one and most important element in our design thinking, which is our patients and their emotional well-being. before we open the camera and start the visit, or before you dial in the phone and start the phone call with them, we want to keep in mind that patients are being exposed for the first time in their life, and hopefully last, to a new reality, like testing, contact tracing, all these terms, right? PPE, mixed messages from the media, social distancing, masking. Patients may be afraid to come to our clinics for the fear of being in the same building or space with possible COVID patients. Therefore, they may be delaying care when needed. Patients may have had experience losing family members, friends, or colleagues. Therefore, although the critical focus on addressing clinical care is essential, there is also a key need to reinforce the human connection and the experience at core. As practices are experiencing between, I don't know how is it for you all, but from all the things that I've read, between 50 to 75% decrease in their patient volume, developing a deep understanding of our patients' experience is critically important driver for improvement and for survival during the current crisis. Not only on the financial viability side, but also to provide you with immediate feedback regarding patient adherence to treatments, to protocols, ensure the engagement and safety for your patients and your caregivers. Patients' voice and feedback is very important at any stage of your implementation process. When you're evaluating and scaling, I don't know, it may take 6 months maybe or longer to prove a new clinical service results or any new program. However, patient satisfaction, or I don't like really to call it because now it's a lot broader than the term patient satisfaction is patient experience, is an immediate measure of success to confirm that the program is having an impact. Patient engagement with the technology can be a key metric that patients liking the program, or it feels that you're offering them a tangible benefit. Also, patient experience surveys is a valued resource for advocacy efforts with the state, the health plans, government agencies, and provider organizations. And as you see here on the screens, this is a sample for patient survey, patient experience survey that you can deploy immediately following your telehealth visits. We will provide you of these samples also so you can custom it according to your setting at your office. Some telehealth vendors may have the capability to host a survey on their telehealth platform. So we will be sending you these samples after the presentation. Next slide, please. So what I did here is I looked at 3 different studies about rating the patient experience with telehealth programs. And what I did is I looked at 3 different times to evaluate the benefits and opportunity. The first one that you see here, that was done by the Burrell Institute, about 1,000 patients. They were surveyed the first week when COVID went out. So, well, the emergency order, so March 10th to March 20th. And we already can see the measures and the trends. You see positive feedback, where I don't know if you can see it clearly, but like 38% prefer to discuss symptoms when they're feeling sick or via video conference rather than having it in the office. 36% prefer to, I think as I'm reading it right, to talk to a counselor about their mental health via video. At the same time, we have some room of improvement here when we see trends, less preferred video visits when receiving results of a medical tests compared to an in-person visits. Next slide. What I looked at here, and there's a reference at the end, and if you're interested, I can send you this, the link. What I looked here at the survey that was, the study that was done actually in between 2018 and 2019 by the Massachusetts General Hospital for patient experience with telehealth for patient follow-up care. The study, so this study was done before the crisis, so it gave us an actual, very good feedback about how patients are perceiving telehealth in the normal, I will say, quote unquote, between the normal setting. They did an observation over a year, and some of the results, as you probably all know, very similar to the current crisis results. Patient rated visits highly, and majority were recommended to family and friends. Most patients and clinicians perceived no loss of communication in virtual video visits. Patient perceived considerable added convenience, saved on time, important and useful option in clinical care. Let's do next slide. Shannon, can you go to the next slide? Oh, okay, yeah, that's it. So what I did here too, I did look at Press Ganey's last survey, or actually the results of their surveys, and they surveyed folks in April of this year, so right in the middle of the peak. And I know Press Ganey is more on the hospital side, but I wanted to share some of the recommendations for service excellence. We do have the reports that I can share with you as well after. They have a lot of good feedback and information that may be useful to you. And I'll just to mention, Press Ganey administered more than 3.5 million telemedicine survey in the month of April. Just imagine the magnitude of the data that's been received. And it all indicated very similar rating for patient experience as is in person visits. Probably some differences here and there in the delivery methods. And we will send you the reports if you are interested. Really good feedback. Same thing in their finding, they found that top drivers for recommending the care in a virtual visit, just like it is in person, demonstrating empathy, involving patients in decision-making and communicating effectively. People will likelihood to recommend the video more if there was additional coordination of care around the virtual visit and technology issues. Also, there was some setbacks, just how we just had here on patients using the technology, and some age factor there between younger patients and older patients. And they provided some recommendation. I think Yvonne just kind of mentioned some of them here, and you have them here on the screen. You know, be genuine. It's just our common things, how we do it in person, exactly how we do it in virtual. Be genuine, be conscious of the warmth of opening, closing greetings, confirm the patient can hear you and see you clearly, avoid interruption, set the agenda, identify patient priorities, your empathy again and again and again. Visual cues must be equal to verbal cues. So, you know, if you're connecting with your patients via email, so also when you open the camera, you know, turning around and maybe typing or doing all these things away from the camera might lose that kind of personal connection. And at the end is the closing checklist and how you close the visit and you summarize the post plan. Next slide, please. All right. And here, just as you are doing your marketing for your in-person normal setting type of situation, we are more now working on staying financially viable with your existing patients, but also we still would like to get some new patients in the same framework and probably generate more referrals. So just very general marketing tips. Maintain the human experience in the time of virtual connection, meaning how are we going to communicate in our marketing language? If you're putting things on the website or on your patient portal or on your social media or via any email campaigns, how to communicate frightened patients during COVID crisis. It's really not much about the technology, it's about the people giving and receiving the care. When you're creating these marketing messages, we want to address some key questions. Does this message help people feeling safe and secure? For example, we can say, this is up-to-date information, bring or show some up-to-date information about measures being taken to disinfect and ensure patient safety. How might you promote a sense of reassurance and comfort, meaning you can have content around consumers, you know, new day-to-day challenges, how to stay physically and mentally healthy while you're working from home. And even broader, how we build the community to bring people together. So example, if you're offering some online classes or other support groups. And just the list goes on and on other things. So support the emotional benefits of telehealth rather than the functional. So when we are saying our messages, you know, when you're putting all your media work out there, you know, use those words, right? The convenience 24/7, rather than actually talking about the technology itself. And also make it visual. So when we adding more colors and cheerful, positive images, make it easy for patients to find you and understand the services or your shifting of service. So from in-person to telehealth. So just how we talked about the survey, using their daily review of these surveys, comments in your marketing campaigns, it's a great resource. Also, one powerful message is the personal story. Like if you had, for instance, a positive COVID patient or anyone in a critical situation, you were successfully were able to manage their care via telemedicine. So I think getting someone like this on a camera and shoot a quick video and put it up on your social media, if they agreed, I think that would be a very great way of putting the word out there. And also just your normal setting of search engine optimization, the social media, wherever you're putting out there, if you decided to do any paid advertising to initiate that you're offering this service. Also make the consumer pricing transparent and easy to understand. So as we all know, cost of share now is waived. So I think a message like this will let patients know that they can receive the service without having to pay anything. I think that's a huge one here. Also your rating and reviews, you know, this is normally, this is in person or via telehealth, is the same. Hopefully it will stay as up as the experience surveys that we just received now. Update your provider directories. We talked about this last time. Your CAQH or your health plans, update your directories, let them know that you're offering telehealth, have that visual with the health plans. If you're having, we all like free things. If you have any free classes, any group visits that you're offering some freebies there, people love free things. So make that known to your people. And just finally, which is just the comment one, very common one, is just know your audience. So when you're trying to identify where are you targeting your competition, per se, you're gonna know, you know, demographics, your geography, your insurance, your patient panel, what is their needs, and how does the service is gonna help them solve their problems. Next slide. And let's do, yeah, right here. So right here, I kind of collected some marketing scripts for you that you can use when you want to put it on your website or your portal or your email marketing to your patients for new or existing. And if you want more than these, I have actually a list of all of them, a lot more than those. I just kind of give you some examples of what can you use to promote your services. Last slide. And what we did lastly here, we actually, for the sake of this presentation, we wanted to get feedback directly from the patients. So we want to use direct quotes and interesting insights from the patients. So what I did is last week, we asked one of our practices, Dr. Chris Garofalo, he's with us here tonight, to ask his patients one simple question. What is the biggest benefits of telehealth for today's appointment? Only one simple question. And when we received over 20, I believe, responses just to answer this. I mean, just one of them in the corner, if you can read it, I'll just quote it. This is important to me as a COVID survivor who was near death and intubated. I mean, how powerful is this when you take it to your legislators, right? So, you know, another one, I get to see and speak with my personal physician without concern to exposure to pandemic virus or other sick patients. My telehealth appointment was face-to-face interaction with my doctor that helps calm my nerves as I approach my due date. So a lot of powerful messages here that you can use for advocacy, you can use for your marketing campaigns. And I think that's it for me. Shannon, I'll turn it to you for more polling questions, I think. Thank you.
All right, thanks, Bisan. And Stacy, I'll queue up the polls if you want to go through the questions.
I was muted, sorry about that. Sure, so again, we wanted to put out a couple of polling questions, not only to get a sense of where you're at now, but also what some kind of key interest areas and or challenges, barriers that you see currently and moving forward. Because again, this will help us start to take a look at what we currently have for the project plan for the remainder of the TTI kind of scope, and then readjust to just help better support this group of physicians and practices that are leveraging telehealth a little bit earlier than we anticipated, and maybe are interested or already starting to use other types of digital tools. So looking at how we can support that. And prepare potentially again if we do see kind of a resurgence come the fall and winter. So how can we kind of prepare for that ahead of time and support this group through that? So the first question in the poll is what type of telehealth platform did you choose? And asking this mainly again because we want to know, you know, is it a platform that you can use in the long term, and we know that, or is this something that, you know, you may not be able to use long term once some of the HIPAA relaxations and things like that may get rolled back. So want to just kind of be prepared to support practices in that transition if it's needed. So it looks like so far, majority have implemented a HIPAA compliant telehealth platform. So that's great to hear. All right.
We'll have a few more coming in, but we'll close the poll in just a few seconds if you want to go ahead and make your choice. All right, I'm going to end polling.
Perfect.
All right.
So next.
That's good. I like the answers. That's great that y'all went mostly with the HIPAA compliant. And then polling question 3.
So where are you with telemedicine now? Again, choosing all that apply, that feel right to you, but really want to know kind of to what level you're using, how you have or are starting to design your practice, how you're integrating, and if you're integrating care team members. Do you have templates in your EHR already set up to help facilitate quickly documentation for telehealth visits?
Okay, looks like most are finished. Good responses. I'm going to go ahead and give just a few more seconds if you've not made your choice yet. And we'll end polling.
All right. And then we have one more question. And this is really focused on kind of what are your priorities as you continue to use telehealth and potentially even expand above and beyond kind of video visits and audio visits, but other types of telehealth that you might be interested in using or performing, like remote patient monitoring. You know, are you currently using a platform that's integrated with your EHR? And if not, you know, is that something on your roadmap that you would like to see happen in the coming months? So again, really looking to see what your priorities are for the continuing time period of especially of this particular initiative, so that we can develop the content and the resources to help support that. Awesome. So definitely seeing a lot of using other telemedicine and remote monitoring tools. So that's really helpful to know. And we definitely have some existing content on specifically remote patient monitoring. So I think that's definitely an area and a topic that we can, you know, start to explore a little bit further in the coming months. And then making telehealth a regular part of my practice routine and care algorithms. Great.
All right, we'll give just a few more
Yeah,
seconds.
great response. Thank you. Super helpful as we continue with this work.
All right, we'll go ahead and end the polling.
Awesome. So those were our polls. That was very helpful. And I know this is probably in an upcoming slide on next steps, but we've also incorporated some of these questions into the survey that we've distributed, or I think most have been distributed by this week now. And all participants have until June 19th to fill that survey out. And that will also help, again, kind of inform next steps. And we definitely have some questions around remote patient monitoring and things like that. So we'll also leverage the results from those survey questions to help inform future content and direction as well, but definitely wanted to get some of that early quick feedback through the polling function here to get started sooner than later on that. So I will turn it over to Shannon and Bisan and Matt, I believe, from the state side to kind of start some round robin practice updates.
Yeah, thank you, Stacy, and thank you for working us through those poll questions. So at this point, we would like to have one physician from each of our participating states to give an update and a little bit of information about how they are working through some of the challenges with their practice and what they're doing with telemedicine. And if it's all right with Massachusetts, we'll go ahead and start with you, Dr. Garofalo. And thank you for sharing the patient experiences with Bisan. Those were interesting to see, but I'll turn it over to you if you don't mind. Unmute yourself. And there you go. Yeah. Thank you.
Okay, did it work? All right,
Yes.
I'll probably will invite Dr. Grace Garofalo to speak and give us an update about what he's doing. And I really would like to thank him for doing that quick feedback survey that we did with him last week. It was a good exercise. Dr. Garofalo, if you can unmute yourself.
Yes, thank you.
Mm-hmm.
Thank you for holding this. This is actually, and I will say, this time works wonderfully. I haven't been able to attend some of the other ones live, but this time works really well. I know you guys asked about that. I actually have found more opposition to telehealth in my practice. We have 10 people among the other physicians than I have found amongst the patients. And I think it's going to be harder in my practice to actually get the physicians to latch onto this than it is patients. Patients really enjoy this. I do make a point to my patients to say that, look, this is not the end all be all. You know, there is still a place in medicine for a face-to-face visit. There is still a place for touch. There is some intangibles there that maybe we can't measure. But I think patients and physicians both benefit. You showed a little slide that said that I think it said basically like physicians seem to miss sort of that personal contact a little more. And I think that's very true. I think part of that is because we are evaluating the patient while we're there with them. And, you know, part of our exam is just looking at them and being in the room. And, you know, so we're sort of, we miss that. There is a little bit that we miss. Some of the things that I've noticed that patients really enjoy with this, I notice patients take notes more often. They'll be sitting at their desk and they'll take notes. So I think this has the opportunity to improve compliance or adherence. Patients, it's much easier to reconcile their medications because they have their medications right there. It gives us an insight, and Bisan mentioned this before, into what their environment is like in their house. I made a couple of other notes here. I think one thing that I have enjoyed is being able to get feedback from the patients, and I've actually already sent a message to my company, which is doxy.me, that I would really like to see them, before the patient hangs up with us or before we hang up with the patient, that they go immediately to a survey. It can be one question, it can be 3. I think surveys that are done immediately give you much better data. I think you're more likely to get more responses as opposed to something that gets sent out by, you know, the healthcare quality people in Massachusetts 6 months later. You know, those response rates are, you know, 5% type of thing. I also think that when the patient has a good experience, having them write that down cements that experience to them. The other thing that I think we can do with this is we need to bring this to the employers. You know, when employers get on top of this, they will go to their health insurance carriers and say, you need to pay for this. I would much rather have my patient take 15 minutes out of their day to go and do a video visit than I would with having my employee miss half a day of work because they have to go to their physician. And that even holds true for urgent care. You know, patients want convenience and they want to be able to get care when they want it. Up till now, urgent care provided that. This is a way for primary care physicians to take that back, and that will help to increase continuity of care. So thank you.
Thank you.
Thanks,
That was excellent. Matt, do you want to introduce your physician for this evening?
Helps when you unmute yourself. We're going to have Dr. Maureen Wheelahan speak. She's a OBGYN in Palm Beach.
Thank you.
Hello, everyone. Can you hear me?
Yes, you sound great.
Okay. So, well, South Florida, Palm Beach County, as you can imagine, most of our folks are over 70. So they were the shelter-in-place population, and they were very reluctant to come in. So obviously we had to think quickly. So I actually I operated probably half on a HIPAA compliant platform called Carie, CARIE.com. And I also operated on Zoom. But essentially I would do whatever it took to get the patient seen. And going forward, you know, we're gonna have to figure that out. Obviously the difficulties were trying to get some of these older folks and even the younger folks to be able to log in and be able to figure out how to successfully connect. But those who figured it out were so excited when they could see me on the other side of the screen. They just were tickled that they could see it. And if I happened to be at home and they could, you know, see something in the background at my house, but I got that same excitement when I interviewed them, when I could see their cat jumping on the shelf behind where we were talking. So it was really fun. I felt like the patients were much more engaged when they were relaxed in their home. You know, in gynecology, you know, they know they're getting naked. They know there's a speculum exam. They're already worried. So when they're sitting at home and their pants are still on, they are tickled to have a conversation with me, and they're calm and they can think about all the things they wanted to talk to me about. So I find that the interaction is much more fruitful for the patient, and of course it's fun for me too. Obviously the payer problem exists. Florida's a pain in the butt when it comes to payer mix, and you know, they don't all agree. Do you pay? Do you collect copay, deductible? Who knows? I have a policy in my practice that I collect a credit card on everyone on file, sort of like a hotel. And so whatever the claim adjudicates, if I have money due, I collect it from the patient. So that's never a problem in my practice. It hasn't really set me back on the financial side, but it's always a spinning wheel trying to figure out. But I think going forward, it's a new way of life. I enjoy it. My patients enjoy it. While I have had a couple of patients who wanted to direct the camera to a sore in the area that they wanted to show me, that was a bit more than I needed to see on the camera. Most of the conversations were hormones and medication adjustments and things that I didn't need to have a below the waist exam. And most of it I could have by description and get a pretty good idea. So overall, I think it's been terrific for the patients. It's been terrific for me. For the most part, the payer mix has given us reimbursements that I hope continue. And I think this is a new frontier in medicine that will continue going forward. The easier we can make it for patients to understand how to unmute and open up their video, or at least let the inviter do that for them, which has been helpful. I think all of that will add to the success going forward.
Fantastic. Thank you so much. Appreciate your sharing all of your experiences. And at this time, I'd like to ask Dr. Lathy, one of the Texas physicians participating. Dr. Lathy, are you on?
Yes, I'm on. Unfortunately, the camera on my laptop is not working. So you cannot
hear you great. You sound good.
You cannot see my handsome face. So we had a unique experience. I'm very excited to share my experience with everyone. We had a practice of 2.5 physicians and 4 nurse practitioners and 1 PA. My patient base is mainly geriatric, outpatient geriatric, patients at home, personal care home, as well as patients in the nursing homes and hospitals, as well as palliative care and hospice care. So it's mainly the geriatric population we take care of. So main hurdle was the technology. I used the Doxy program. We are quite happy with the program, except that I wish we could make it simplified that we can bypass the step of getting the patient to log into that. It should be simple like the FaceTime. So a lot of my patients who had difficulty, I would just hang that down and call them on FaceTime. Most of these old ladies and men are used to FaceTiming with their family members. So it was easy to FaceTime them, except for this so-called HIPAA issue, which I think is a non-issue because see, a lot of time, patients call us middle of night, the emergency room calls us, and we give them appropriate answers on the telephone. Our regular telephone is not HIPAA compliant. So why should the telemedicine program should be HIPAA compliant? That's a technical question for the lawyers. But the FaceTime worked wonderfully well for some of these old ladies who could not handle the difficult programs. It was very rewarding to see that the patients were happy that they saved almost 2 hours of drive time or wait time, and they could do it from the clinic. A lot of my colleagues and nurse practitioners and the nurses at the nursing homes were apprehensive in the initial phases. So the first thing I did was I talked to them about what's the good old clinical medicine. The good old clinical medicine that I learned in my working days and training days in England, it is where you sit with the patient, you talk to the patient, you listen to the patient, and by the end of your history taking, before you touch your patient, in your mind, your 90% of your differential diagnosis is prepared. So your physical examination, especially, I'm not talking about the specialties, but in family practice or internal medicine, the physical examination can add maybe 5% and the laboratory testing and stuff another 3%. So you come to about 98%, which will be a great number. So this helped us, the telemedicine helped us to focus on good history taking. Rather than, in a busy practice, the modern day practice is you're taking a quick history examination, order a bunch of tests. Whereas here, you cannot do that. You cannot do an examination. So you're more focused on history taking. And to our surprise, even my nurse practitioners were very happy to make their clinical decisions based on good history taking. And the second part, the iPhone with the FaceTime help was, if they had edema or they had any skin lesion they wanted to show me, they could always move their phone wherever they wanted to move and show me, which was difficult on a laptop or a computer if the patient was using. As far as my reopening of the practice, yes, we are reopened the practice, and we are using the telemedicine in a big way. That is helping me because when we reopened the practice, we didn't want the patients to be coming together and sitting in my waiting room, making a crowd and spreading infection. So by using telemedicine and actual clinic visits, mixing them together, what we achieved is we have only one patient coming to the clinic at any given time. Patient sits in the car, my nurse calls the patient in straight into the examination room, so there is no contamination anywhere else. And we see the patient and take care of the patient. And while the nurse is waiting for the next patient or getting ready for the next patient, I do another telemedicine visit on my laptop. So most of the follow-up visits, which we can do on the telemedicine, we are doing that. Most of the teaching and counseling and also routine annual examinations, we have tried doing it on the telemedicine and work very well. Especially health education, which is a very big part of us as primary care physicians to improve the health of the population rather than teaching, or rather than treating when they are deceased in a disease format. So that has been very useful as a telemedicine source to teach them and counsel them and good practices of health, especially in the COVID situation. I've taken the opportunity to teach them about healthy eating, exercises, weight loss, blood pressure control, talk about smoking, alcohol. So in multiple ways, it has helped me. My biggest challenge is still going to be the technology, especially because my patient base is elderly females. But overall, we're very happy. We're very excited to continue to use the telemedicine. Thank you.
Thank you, Dr. Lathy. Excellent advice and guidance there. Appreciate you. So a couple of next steps. As Stacy mentioned early on, there is the Telehealth Initiative Research Survey that hopefully all of you have received. If not, it should be forthcoming. I know for the Texas physicians, I sent it maybe Tuesday, maybe Friday. Are the days running together for you like they are for me? So anyway, that should be in your email and I'll send a reminder soon. Our next webinar is scheduled for July 23rd, so we will not have one in June. But as a last poll, we want to ask you about which time works best for you. Dr. Garofalo, you already said that this evening time was great, but if you wouldn't mind, and I realize this might be a little bit skewed because we're asking the group participating in the evening, but just real quickly choose what you like best. So far, evening is much better, so we'll probably continue with that. We still have our in-person meeting scheduled for late August. We are certainly evaluating all options as far as what will be safe and what will be best. So keep your ear to the ground. We will provide an update once we know more on that. But hold the date on your calendar, and if you have an appetite for travel, we may still try to do something on a smaller scale. But again, we'll evaluate all the options and see how things are going as we move into June and then into early July. We should make a decision. I also wanted to mention, I'm going to go ahead and end the poll in a couple of seconds. So if you've not selected, please do. Also wanted to mention that in the chat function, there's some great discussion going on. And if you would like to save the chat function, you certainly may. You'll see over, if you open the chat, the ellipsis, the three dots, if you'll right click on that, you'll see, excuse me, not right click, left click, where you can save the chat. So if you want to refer back to it, but a great conversation going on there. Still in the polling. So clearly the evening time is better. I do want to thank Dana with Massachusetts Medical Society for working on the CME approval for this program. If you would like to claim the CME, please click the link. I'll also send it out independently to the Texas physicians, and Matt and Bisan, if you'll do the same for your group to make sure that everybody has the evaluation. But please fill out that evaluation and submit it, and you will receive a CME certificate for the 1 hour, which will be sent to you from Massachusetts Medical Society. And again, only those participating in the live version will be able to receive that. We are recording this, so we will have it preserved for you as well. I'd like to thank all of the speakers tonight, Stacy Lloyd with AMA, Bisan Viari with Massachusetts Medical Society, and Yvonne Minkoon with Texas Medical Association. Thank you all for your expertise and for how you've brought together some really great information as we continue with this initiative. Again, your teams, we are always available to you, so please reach out if you have additional questions, but otherwise we will let you get on with your evening and have a great one. Take care, everybody.
Thanks so much.
Thank you,
That was
Juan.
great. Thank you.
Thanks, Shannon.
Thank
Thank
you.
you, everyone.
Thank you all.
Everybody.